Good morning. Again, thank you so much for inviting us here to share our experience. And basically, I'm going to provide a little bit of the story from a vital records perspective of how we experience the process of doing registrations after Hurricane Maria. But I am going to start just talking a little bit back, giving you a little bit of background. The Puerto Rico Demographic Registry is responsible for registering, collecting, and reporting vital statistics. In 2014, our data collection information system was reviewed, and a plan was developed to fully comply by January 2016 with the adoption of the death, birth, and fetal death U.S. standard certificates. But unlike in most jurisdictions, the Puerto Rico registration process was and still is completed following a process based on paper certificate forms, and not through an electronic vital records registration system. This essentially means that the corresponding certifier manually completes the certificate paper forms. Then, the certificate must be presented at the local office for review, completion of the registration process, and data entry into our information system. Adding to this, in our current process, and specifically to mortality data, there is an extra step that has to be completed at our central office level only. The cause of death section data of the death certificate is entered on a separate system. This step generates basically the files that are transmitted to NCHS, to the medical classification area, in order to initiate the ICD-10 coding process. As consequence of the Hurricane Maria event, the Puerto Rico mortality registration lag time, the difference between the event date and the registration dates for the death demographic data only went from an average of 10 days during the first months of 2017 up to 23 days in September and 18 days in October and November. The average lag time for Hurricane Maria cause of death ICD-10 coding data transmission to NCHS was at 62 days. Basically, that means that it took us 62 days to learn what a person died from after the date of the event. So, when talking about registration timeliness, a paper certificate registration process is not suited for producing mortality statistics with the expected promptitude of today's world. There were many published articles on how some jurisdictions have been able to move beyond a vital records only role and are now supporting other public health functions by using death data gathered through their electronic registration systems. Improving the timeliness of collection and reporting of vital records data has transcended its use for reporting vital statistics to a more concurrent approach that allows its use as part of mortality surveillance efforts, disaster, flu, opioids, etc. Unfortunately, that was not the capacity of the Puerto Rico Demographic Registry when Hurricane Maria struck Puerto Rico on September 20 of 2017. We faced the operational challenge of continuing operations while lacking power and communications services. The local offices started to open as soon as the building infrastructure was ready, no major physical damage, but initially in a limited fashion, only to review and accept birth, death, and fetal death certificates. Weekly routes were established and a staff drove to collect those certificates at the local demographic registry offices through the island. The certificates were brought to the central office for completing the registration process and manually entering the information into our data system. As part of this response, daily reports were developed to track progress of registrations and to monitor the amount of deaths per day, month, as compared to 2015 and 2016. Because our death registration system is not integrated, the literal cause of death data was not included in entries to our data system. So to properly monitor that information, we developed a data import into our system to incorporate that information so we were able to track the information that was being completed by the medical certifiers. This process basically allows us to see how many deaths we were getting that were documented as related to Hurricane Maria. Additionally, we also coordinated with NCHS the daily transmission of the ICD-10 coding files. Instead of doing it on a weekly basis, we started doing it on a daily basis. That enables us to track and to start analyzing mortality data more effectively. When the amount of registration began to show a significant increase in frequency of daily death versus previous years, we raised the flag through the applicable channels. The increase in death during the first 40 days after the Hurricane Maria was undeniable, but very few certificates stated that the death events were related to the disaster. The cause of death that increased the most within that period were pneumonitis due to solid or liquid intake, septicemia, renal and hypertension disease, suicides, Alzheimer, pneumonia and influenza, diabetes mellitus, and nephritis syndrome. This description of our current vital records registration system serves as evidence of why it is important to have in place electronic vital records registrations to support other public health functions. But these systems alone can't be perceived as the solution for having better reporting of disaster-related deaths. Coordination, communication, and integration with stakeholders and data providers is fundamental to align efforts and enhance collaboration towards better mortality statistics. Through the hurricane supplemental funds available to jurisdictions that were affected by storms in 2017, the Puerto Rico Demographic Registry was awarded funds for a project aimed at improving disaster-related death registration process and to improve death account accuracy. Our project proposed achieving that goal by training medical certifiers about correct cause of death reporting on the death certificates and on how to identify and document disaster-related deaths on the death certificate. Secondly, initiating the transition to establish an electronic death and birth registration system. The reference cause of death training project has already been completed. We currently are working on several strategies to assure the continuity of these training sessions, and we are fully immersed in the transformation of our operations around the electronic registration system that will be acquired. As a last thought, it is fundamental that leaders, decision makers at all levels, and medical and public health practitioners understand the value, the importance, and the scope that vital statistic data has. It is also vital that they are attuned on the current and particular challenges that the vital records agencies may have to face to respond to the challenge and demand of producing better and faster mortality statistics. Thank you.
Thank you.